GEMServe is a new direction in patient feeding within a healthcare environment. What we've done with our GEMServe product that's unique is we've taken a hotel-style experience and brought it to the patient in a healthcare environment.
We try to offer a more liberalized diet here just because the majority of our patients here really aren't eating well to begin with. We just really want to make sure that their intake is adequate and that they're eating well again.
Now when they're eating foods that they know they like, that they want to have, at the times they want to eat it, they are consuming more nutrients and getting healthier sooner than they might otherwise.
In tray-line service, patients were really limited as to what they could get. In most hospitals, they were just given something. Where GEMServe allows multiple entree options, side options, you really are able to capture what the patient wants in a meal, which improves their intake of meals. You have less plate waste, you have greater satisfaction as far as patients. It really is a great system.
We've seen an increase in patient service scores. Our scores used to hang around the 88%. Now we're averaging about 95 to 96%. To the healthcare field, that's a major deal.
I really enjoyed the room service aspect of it because I could order what I want when I wanted to. When I ordered something that wasn't in my dietary plan, they already knew ahead of time, but I was still able to order good food, and I actually find myself looking forward to coming back again the next time. It was like being in a five-star hotel and picking up the phone and ordering room service.
By me being able to choose what I want and getting that played a very important factor in me coming back to this facility.
We have taken the most simplistic approach that we could. We took a hotel-style room service experience utilizing the same type of hardware that those customers utilize today, being a micros point of sale.
Hi, Mr. Bishop. And what room number are you in? 202? And what time would you like your meal? 6 p.m. is available. You would like one hamburger with ketchup, lettuce, and tomato. And what would you like for your beverage? Iced tea. So I have one hamburger with ketchup, lettuce, tomato, and an iced tea. Your order will be up at 6 p.m.
We have found that our use of Microsoft standard SQL databases and browser-based technologies has helped our implementation time and has helped eliminate some of the learning curve associated with a new software product. Our typical implementation time from the day we sell the product until the customer is up and running is somewhere between 90 and 180 days.
One of the unique things about GEMServe is that it's not hard to teach. If you know how to use a computer, you can use that. So it was just so easy.
GEMServe gives you a lot of control over what patients can and can't have. For example, if someone's on a diabetic diet, you can be sure that GEMServe is not even going to allow your dietary staff to be able to offer them something like chocolate cake, which we wouldn't offer somebody on a diabetic diet.
And what would you like for dessert, Mr. Bishop? Chocolate cake? Okay, I am showing that you are a diabetic. May I suggest the sugar-free pudding?
We have designed it from the ground floor up to be lean, which means we're taking and making this a much more productive process.
About 30 after, it's going to turn yellow. And when it turns yellow, the time has expired. It's prompt the expediter to let them know that this tray needs to get to the patient at least within a 30-minute range.
One of the things it's done for me is that it immediately cut down on cost. One way it's done that is help me to maintain, not only cut down, but maintain a reduced rate of about 5% in my cost of food.
We pretty much know the standard recipes we have for the limited number of entrees and sandwiches that we might offer. And then it's a simple practice of just analyzing those and then entering those.
And one of the things I might add that I know is true, you don't always have to add staff when you're using this service. I did not add any staff.
As an administrator, you're always a little apprehensive when someone calls wanting to speak with you about a service line because you're steeling yourself for a complaint. Room service, once it's fully implemented, it goes so smoothly that that's not an area of your service that you have to worry about.
GEMServe has allowed our employees to take the responsibility. They're using their gift in order to put personal service onto what it is that they're doing, and they love it. So that's what GEMServe has done for us.